Bismillahirrahmanirrahim, my lovely nurses. I hope you are all fine. So our today topic is cardiac tamponade. Today topic is cardiac tamponade. Now first we will talk about what is cardiac tamponade. So the description is a pericardial effusion occurs when the space between the parietal and visceral layers of pericardium fills with fluid. So a pericardial effusion occurs when the space between the parietal and visceral layers of pericardium filled with fluid. Now, what this pericardial effusion will do? The pericardial effusion what will do? Places the patient at risk for cardiac tamponade. Pericardial effusion places the patient at risk for cardiac tamponade. And what is cardiac tamponade? An accumulation of fluid in pericardial cavity. So first the pericardial effusion occurs when the spaces between the parietal and visceral layers of pericardium filled with fluid. Now this pericardial effusion, what will do? The pericardial effusion places the patient at the risk for cardiac tamponade. So what is cardiac tamponade? An accumulation of fluids in the pericardial cavity. Now what this tamponade will do? Pericardial effusion become the cause of cardiac tamponade. Now what cardiac tamponade will do? The tamponade restricts ventricular filling. So what will happen? If ventricle will not fill with the oxygenated blood, so what will happen? Cardiac output will drop. One nursing tip, keep in your mind: the acute cardiac tamponade can occur when small volume 20 to 50 ml. So 20 to 50 ml fluid is always there, so it will help the heart layers to the lubricate. But if this 20 to 50 ml fluid accumulates rapidly in the pericardium. If this 20 to 50 ml fluid accumulates rapidly in the pericardium, what will happen? Acute cardiac tamponade. One thing keep in your mind, the cardiac tamponade is a medical emergency. As fluid or blood fills the pericardial sac, compressing the heart so that it cannot fill and pump. Once the heart will be compressed, is very difficult. It cannot fill and pump. So what's the result will happen? The result is a dramatic drop in blood pressure, and if the dramatic blood pressure will drop, the patient death also can happen. So this is a medical emergency. Keep in your mind one memory trick. One memory trick, triple C. C, C, C. Keep in your mind the memory trick C, C, C. C is cardiac tamponade. Tamponade. The other C, compression on the heart. Compression on the heart. And the other C, critical client. Critical patient. When you will receive questions in the NCLEX or there, sometimes they are writing client also. Sometimes they are not writing patient. The client means patient. So C, cardiac tamponade. C, compression on the heart. C, critical patient. So this triple C, if is there, this is a medical emergency. Now what's the causes? Causes of cardiac tamponade. Number 1, trauma. Any trauma, for example, stabbing. Stabbing means someone cut with the knife. Or MVA. MVA. What is MVA? MVA is a microvascular angina. Microvascular angina is a type of angina caused when the small blood vessel of the heart, see micro, the small blood vessel of the heart, microvessels, do not work properly. The microvessels are important as they supply most of the blood to the whole of the heart muscles. Okay, so microvascular angina is also the cause of the cardiac tamponade. What is microvascular angina? The small blood vessels of the heart, when it will not work properly, it can happen. And then this is acute causes. These both are acute causes. The chronic cause is pericarditis. If patient have pericarditis, that is also the cause of, it can become the cause of cardiac tamponade. Now we will talk about the assessment. Assessment mean once patient come in the emergency, what sign symptom you will observe in the patient. Number 1, pulses paradoxes. This is the nursing tips. They can ask question in the exam. The pulses paradoxes. What is? The systolic blood pressure drop 10 millimeter per mercury. For example, patient blood pressure before is 120 by 80. But if patient came, the patient have cardiac tamponade, the blood pressure will be 110 by 80. The systolic drops 10 millimeter per mercury. Number 2, increase CVP, central venous pressure will be high. JVD means jugular vein distension, but with clear lungs. With clear lungs. Distant, muffled heart sounds will be not good. Decrease cardiac output because the fluid is compresses the heart, the cardiac out will be decrease, narrowing pulse pressure. So once patient will come in the emergency, these all sign symptom assessment you will observe, and then you will diagnose this patient have cardiac tamponade. The ECG, the question can come in the exam. If the patient have cardiac tamponade, they will give you the 4 options, mean the ECG changings. What you will observe in the ECG, the patient came with cardiac tamponade. So in the ECG, always keep in your mind the QRS complex, always the QRS complex short and uneven height. For example, I will draw one picture for you. For example, this is QRS. So this is short, then uneven, it will go very high, PQR. So what will happen? See, suddenly it go up. Before is short, then after some time uneven height. So if ECG will show like this, they can give you the picture also in the exam. So this is cardiac tamponade. This ECG is showing patient have cardiac tamponade. Now we will talk for the treatment. What treatment we will give to the cardiac tamponade patient? Always cardiac monitor, very important. The patient should be in the CCU, critical care unit, the cardiac care unit. Sorry. Administer fluids, because patient have already decreased cardiac output, no? So to maintain low cardiac output, we have to administer proper fluids as per doctor prescription. Prepare prepare patient for X-ray chest and ECG. Very important. Prepare the patient, the very important pericardiocentesis. What is pericardiocentesis? They will put a catheter in the pericardium to remove the extra fluid. So pericardiocentesis is very important. Monitor for recurrence. Once pericardiocentesis done, then we will monitor the patient. Maybe the fluid will again refill. If the client experience recurrent tamponade or recurrent effusion or develop adhesions from chronic pericarditis, so what is the last treatment? A portion pericardial window, where is the fluid is again filling, and again this effusion is coming. So what will they do? Doctor will do all of the pericardium. The procedure name is pericardectomy. Pericardectomy may be removed to allow adequate ventricular filling and contraction, but that is rare. The most important is pericardiocentesis. Pericardiocentesis is very important, and if the catheter is there, We all observe the catheter attached to the drainage system, assess drainage. What we will assess drainage? The type and speed of drainage, which type of fluid, which color of fluid is coming, and what's the speed of the fluid. So at the end we will discuss one thing. So that is some evaluation. We will evaluate what we did before. So the nurse is evaluating the condition of a patient after cardiosynthesis performed to treat cardiac tamponade. They did cardiosynthesis, mean they removed fluid for the cardiac tamponade. The nurse determined that the procedure was effective when noting the following when comparing pre-procedure and post-procedure assessment findings. So nurse, already the cardiosynthesis performed for the cardiac tamponade. Now nurse is observing the assessment, the signs symptoms of the patient. Pre-procedure, she is comparing the pre-procedure symptoms and the post-procedure. So how she know the procedure was effective? So as we discuss for the sign symptoms, everything will be opposite, mean the clear breath sounds after cardiosynthesis. Blood pressure will be increase BP. The JVD will be normal, the jugular vein distension will be normal. Decrease CVS, the central venous, the pressure will be decreased, before is increase. And the sign of the cardiac output, that the cardiac output will be increase, because before is decrease. The pulse rate and rhythm of the client, strong peripheral pulses, no chest pain and dyspnea. So once patient came in the emergency before the cardiac tamponade, patient have this increased blood pressure, breath sounds are not good, jugular vein distension is there, central venous pressure is increased, cardiac output decrease. So after cardiosynthesis everything will be normal. So in the exam they can ask you question related to this. So that's why I inform you after pre-procedure what sign symptoms the patient have, and the post-procedure what sign symptom patient have. So this is very important. I hope you understand this lecture. If you like, please subscribe, share and give comments to my channel. This is really a big encouragement, and thank you very much. Take care of your family, and especially for you. Allah Hafiz.